It is Valentina's Corners time. How are you guys doing today? I hope everybody's doing fantastic, or as I say, fantabulastic. I am so happy that you're here with me today. Welcome to Valentina's Corner, where we talk about everything nursing, everything nurse mom life, everything fun, good, and positive to inspire you, inspire myself as I inspire you, and just do great things in the community out there as nurses and as people, right? So basically what I thought of doing is starting out with some practice questions that will help you if you're in the beginner stage where you really need to just get used to Nclex type questions and just getting used to the idea of Nclex. Even if you are just starting nursing school or you're thinking about starting nursing school and you've taken some anatomy and physiology classes and anything that is like preparatory for nursing, this is good for you. I want to start from the very beginning. Now, Nclex type questions that are for when you're taking the Nclex exam usually tend to be of higher level, because one thing, I don't know if they've told you, is that as you take the Nclex RN, if you are doing well during the test, during the Nclex, as you're taking the Nclex, the questions get harder and harder and harder. As you reach question 50, if you're doing good, then question 51 will be harder. Question 52 will be harder. So if you know that the level of questions are getting harder and harder, you're kind of like questioning yourself and it's hard and hard, you know that you're doing well and that you're probably on the road of passing. But if the questions are really start to get easy and easier and easier, that means that, you got to start thinking harder during that exam so that your questions can get harder, and then you know you're getting towards passing. So here is a level of beginner level. This is the level where if you're taking the Nclex, this might be that question where you're kind of like, am I passing? Am I failing? Because I'm going to take you from the beginning, very beginning, where you're getting questions like, what is the pericardium? What is the myocardium? What is the function of it? This is to get you to understand where is it that you may be lacking and where you need to focus on to learn and like focus on content, and also getting you in the habit of taking questions, right? So this video specifically will start with 10 questions, 10 practice questions of one of the practice questions that I've had with me that I use at home for a while. And each questions, we're going to go through it with understanding what the question is asking, helping you to practice how to look at a question. And also we're going to go over the answers of the question and how we are getting towards those answers and how each one of the answers that may not be the correct ones, why are those not correct, you see? So we're going to go through those 10 questions. So today is the first set of 10 questions of 75 questions. I think it's 75. If I'm mistaken, pardon me, 75 or 85. So today we're going to go over 10. I don't want to bore you. I want this video to be as short and sweet and beautiful as possible so that it can be as effective as possible. I don't want this video to be longer than it needs to be. So hopefully it is within 10 minutes, definitely less than 50 minutes. And you can watch it, you know, over and over again as much as you please and you like, in the evening before you go to bed, in the morning when you wake up, whenever, just to give you the way to be comfortable on how to take these questions, and then kind of helping you practice on the content side. So once again, this is really for the beginner level stage, to get you used to taking questions, to get you familiar with Nclex, to get you familiar with, once again, taking questions. Whilst the best time to start taking Nclex type questions is really at the beginning, when you know that you're going to start nursing and you haven't even started taking nursing courses. That's the best time to start practicing Nclex type questions. And this is why they want nursing students to take things like the ATI, the HESI while you're taking nursing courses, because they want you to practice. They want you to get used to that level type of questions. So that's really the point. So Think of it this way. You start practicing way before you even begin nursing courses. Whilst you're at the level where you know you've been accepted into the program and you know you're going to start maybe next semester. Now you're starting to take your questions. Now you're starting to see, where am I lacking with my anatomy and physiology? What can I, work on a little bit more so I'm more prepared? And it's also good for those people who are starting their nursing courses. Like right now, you're starting with your, maybe your pharmacology 1 or something like that, or adult nursing 1, something like that. And you want to take these questions in conjunction with your ATI or your HESI. Good for all of nursing students. Okay. Now, it's also good for those who are finished nursing school and they just want to take extra questions, and they've run out of taking Saunders questions, Kaplan questions, whatever preparatory exam questions. They just want to take as many questions as possible. It's good for you guys as well too. But this is better for the beginner nurses who are not even at the level of taking an Nclex RN exam yet. Those people who are ready to take the Nclex RN exam need to really focus on Nclex specific type questions that they're ready to take it now. This is for nurses who need to be ready to understand what nursing questions and Nclex type questions look like, and so that they can, focus on different areas before they even jump into full-blown nursing courses. Or whilst they're taking their nursing courses, then they're now, adding this on top of their ATI questions. Okay? All right, let's jump right into it.
Okay, guys, the first question that we're going to be looking at today is this one. The function of the cardiovascular system involves any one or more of the following functions, and you need to be checking all that apply. So let's look at the answers. A, oxygen transportation. B, metabolic waste removal. C, hormone transportation. D, neural connectivity. And E, CO2 removal. So the answer to this question is, look at it really well. First of all, definitely oxygen transportation. B, definitely metabolic waste removal. C, yes, of course, hormone transportation. And D, neural connectivity. E, CO2 removal. Yes, the right answer is A, B, C, and E. And it is because the cardiovascular system has a lot to do with transporting different things in and out of, our system. But neural connectivity doesn't have too much to do with cardiovascular. Here we go with our second question. All right, the second question is asking, what is the heart encased in? What is the heart inside of? The heart is encased in, let's see, A, the peritoneum, B, the pericardial sac, C, lung tissue. D, it has no encasement. Definitely not D, guys. Definitely not D. Don't even think or dream about that answer because it is encased in something. So let's look at these very, very well. What is it encased in? And this is taking you back to your anatomy and physiology, right? So the correct answer of this is B, the pericardial sac. The heart is encased in the pericardial sac, a connective tissue sac that separates it from the internal organs. Okay, next question. Now we get to see what is the function of this pericardial sac that the heart is inside of. Well, let's look at the answer. A is saying to keep foreign antigens from the heart. B is saying to keep the heart from enlarging. C is saying to provide nutrients to the heart. And D is saying to provide lubrication for the heart. What do you think the right answer is? The right answer, always think about the right answer. Anytime you're answering Nclex questions, never get confused. Just what is the right answer, right? The right answer is that the function of the pericardial sac is to provide lubrication for the heart, so that it's not like when it's beating, right? It has some type of lubrication. So that is the function of the pericardial sac. Guys, I did forget to mention that in this set of 75 questions that we'll be going over within in different video sections, it's mainly about cardiovascular. So the next I want to say maybe a couple videos that you're going to be seeing are going to be about these whole 75 questions divided in 10 sets, but it's mostly or all of it about cardiovascular. And then the next ones we're going to be doing are going to be about other systems. So the fourth question is now asking us, which is not a layer of the heart? A, the pericardial layer, B, the myocardium, C, the endocardium, or D, the epicardium. And the right answer is A, the pericardial layer. The three layers of the heart are the epicardium, the myocardium, and the endocardium. All right, next question. Okay, so the fifth question is asking us to list in order the pathway of blood through the heart from deoxygenated to oxygenated blood. So we just need to list in how do you call it? From A to Z, how it works. So first here is giving us A, left ventricle, B, right ventricle, C, left atrium, D, right atrium. So how does it move? Well, think about it a little bit. The answer is that the blood goes from the right atrium to the right ventricle, then to the lungs, and then to the left atrium and out the left ventricle. You get it? Once again, the blood goes from the right atrium to the right ventricle, then to the lungs, and then to the left atrium, and then out to the left ventricle. That is how it works. All right, moving on. We're closer to the end. Next question, which is our sixth question, is asking us which heart valves are closed to prevent backflow of blood into the atria during diastole when the heart is relaxing. List all that apply. A is saying tricuspid valve, B is saying pulmonary valve, C is saying mitral valve, D is saying aortic valve, and E is saying pneumonic valve. Pneumonic valve. The right answer is the tricuspid valve and the mitral valve because they are the ones that prevent backflow of blood during the resting period, diastole. Number 7. What artery supplies the back of the left ventricle, the inferior of the left ventricle, the right ventricle, and the right atrium? A says left main coronary artery. B says left anterior descending artery. C says circumflex artery. And D says right coronary artery. What do you think the right answer is? Think about it a little bit. Pause the video for a second. Think about it. Think about it. Think about it. Answer is coming. 1, 2, 3, 4, 5. The right answer is D. The right coronary artery supplies the inferior and the posterior aspects of the left ventricle, the right ventricle, and the right atrium. Let's move on up to number 8. Now, number 8 is asking something so easy. You all should know this one. Even if you're not even accepted in the nursing program yet, you should know this answer. You should know this answer. If you don't know this answer, you need to get off this channel now. Go and read. Go and read anatomy and physiology. Because this answer, everybody with their eyes closed, if you want to get into anything medical, you need to know the answer to this one. The 8th question is asking, what is the cardiac output? A, the amount of blood ejected from the left ventricle in 1 beat. B, the amount of blood ejected from each ventricle in 1 minute. C, the amount of blood ejected from both atria and ventricles. D, the amount of blood entering the lungs per minute. The answer is B. The cardiac output is the amount of blood ejected from each ventricle in 1 minute. The normal value is 4 to 8 liters per minute. All right. That's the answer. Now, the 9th question is asking, which factors affect a person's cardiac output? Well, a couple of things, right? Let's look at the answers. A, the oxygenation of blood. B, the stroke volume. C, the blood volume. D, the preload. E, the force of the contraction. Da, da, da. What do you think the answer is? Well, let me give that answer to you. The factors that affect the cardiac output are the stroke volume, the preload, and the force of the contraction. Because if that force is not strong, that means something is going to happen. We're not going to have a lot of blood in our body. So those are the three answers: B, D, and E. Let's move on up to the next and last question. The 10th and last question of today's practice questions that we're going to be taking, or that we've taken, is this one. The natural pacemaker of the heart is what? A, the AV node. B, the Purkinje fiber. C, the SA node. D, the bundle of His. Guys, I have to have fun doing this, so that's why. What is the answer? Tell me now. What's the answer now? Da, 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 da. C, the SA node. You hear this a lot. The SA node is the natural pacemaker of the healthy heart. Thank you guys so much for watching this video. Thank you for sticking around with me. Thank you for taking these questions. This, once again, is basically all about, or this set of 75 questions are going to be all about cardiac function. So we're going to be really focusing on that for the next couple of videos. If you have specific questions, write them down below. But for now, bye!